Welcome back, everybody, to Dr. Sellers Educate. We're happy that you're back. And if you're watching this the week of Thanksgiving, happy Thanksgiving. We are excited to bring you another great episode that's going to help you close more of your knowledge gaps as you continue on your journey to achieving CNE, CNE Novice, or CNE CL success. In case you haven't heard, Black Friday is coming up, and we are thrilled to announce our Black Friday special, which is going to include the CNE in 60 days that will start in January, as well as the self-paced course, along with all of the resources that you will need to close your knowledge gaps. That includes Dr. Caputi's review book, as well as Billings and Halstead 6th edition, and the study workbook. All right, so we hope that you will take advantage of this Black Friday special, and we will be excited to see you in January to close your knowledge gaps as you continue to strive towards being successful on the CNE exams. In this episode, we're going to be focusing on 3 teaching strategies that are innovative, creative, and are aligned with the NLN content for the certification exams. All right. So if you've been here before, you know that that is our framework that we use to support the content that we review. And that is following the educator competencies for all 3 of the exams. We follow the exam blueprint to help you close your knowledge gap so that you can be successful. Ideally, the first time you take the exam, but do know that we are with you no matter how long it takes for you to cross that finish line, okay? You also have access to any of the programs that you purchase indefinitely, okay, for a period of time that is dependent on you, okay? We're here for you as long as you need us to be, and we will be announcing in 2023 a new program to support those of you that are renewing your certification exams. You've worked really hard to achieve success as a certified nurse educator, and we want you to keep it. All right, so there is a certification portal that you have to go through, and there are other specific guidelines that, again, we'll be covering in free webinars that we will offer next year in 2023. So stay tuned for that. So let's go ahead and jump into our episode for our time together today. If you have Dr. Caputi's review book or you have Teaching and Nursing, all right, we're going to be using both of those as we close your knowledge gaps. If this is your first time here, again, welcome. We're super excited that you're joining us. We know that your time is very valuable, and we believe in giving you content that is aligned with the resources, and also by supporting you and feeding you content right here on our YouTube channel. If you have not subscribed, go ahead and do that right now before you forget. We like to spend about 5 to 7 minutes or so on each episode. Some are longer depending on the content. All right. And then second of all, we want you to know that you can reach out to us through email, info@drsellerseducate.com. If you have any questions about the content here, about our Black Friday special, or any of our events in 2023. So what are those 3 evidence-based teaching strategies that we want to focus on today? We know that there are more than 600, I think, is the last count that I looked at. There's a wonderful resource that we'll go ahead and put in the description for this episode. If you're listening to us on Spotify or Anchor, welcome. We're glad that you're here as well. All right, so we have lots of options for you to connect with us as you close your knowledge gaps. Yes, it's important to know what teaching strategies are that are going to help you create a more inclusive learning experience for our students, but we want to know how exactly do they influence our learner. All right, so that's what we're going to be digging into today as it relates to these 3 teaching strategies that we will be talking about. Learning circles is first. This is a great teaching strategy that I have enjoyed using for several years now, specifically with my in-person students, but it's also a great way to engage in the learning process, even with our virtual students or our online students. You can do it in a number of ways. There's technology with some LMSs that allow us to group students in learning circles. And then other ways we can do it is through synchronous experiences, okay? For our online students, we know that it can be challenging, right, to connect for a synchronous experience, but we can offer it to those that are able to join us, where we are going to provide, for example, a current event. Students could read that article, and they could bring their thoughts into the learning circle. Okay, so there would be specific information or talking points that you will want students to contribute as part of the circle. One good example could be a current event related to the affirmative action components that are being discussed right now, that legislation being discussed with the Supreme Court justices, and the impact on admissions. All right, so we could identify as faculty 3 key elements we want to pull from that article. As we talk specifically, this would be most appropriate with our post-licensure. And then for our pre-licensure students, it could be discussions around how the role of the nurse is, in the fact that the nurse is not included in the reimbursement system right now, the impact of the nursing care hours that are being delivered, the impact if that was included in the reimbursement payment structure, how the pay piece could be possibly resolved in healthcare as it relates to nurses feeling like they're not being paid fairly. Same thing with us as nurse educators. If there was specific legislation, which we know there is, if you haven't heard about that legislation, we encourage you to go to our YouTube directory, and that's where you'll find information about when we shared those details. And we'll go ahead and put that here in the description as well. All right, so it's important for us to bring in the current events into these learning circles, ideally as a pre-class assignment, so that when students are engaging with these in-person learning circles, they can really maximize the time they have in person to establish that community. We know our students learn from each other. That is seen as what we call cooperative learning. That is a technique that's going to facilitate students' really evaluation of the content that's being presented and discussed, as well as development of critical thinking. So if we go back to the scenario of specifically looking at how students learn from each other, if there was part of the learning circle assignment, we could ask students to talk about how it contributes to their critical thinking. Now, let's talk about a challenge associated with learning circles. Those students that are more introverted and they may not feel comfortable speaking up. So how can we accommodate their learning preference? First of all, we want to talk to in the very first class about learning preferences or learning styles. So we could engage students in that activity, right? Self-awareness is a really important part of the learning process. So we want to engage students in that as much as we can. So that could be one way the students could self-identify their learning preference, right? So awareness is key. The second step in that conversation could be talking about how we can tailor our conversations and support everyone within our learning community in acknowledging the fact that we all learn differently. So when we get to learning circles, students already have, first of all, a self-awareness of their learning preference. And second of all, the fact that we all learn differently and how we can adjust our community learning experiences to be a more inclusive activity. For the colleague or for the student who may struggle with engaging in small groups, perhaps there's an opportunity for us to assign each person to address a specific topic related to that article. All right, so for example, if we have a naysayer in the group, we could give them that card. If we have a student that is a supporter, we could give them that card as an example. So again, we're prompting and probing conversations within that learning circle so that all students are included. Next is going to be technology. Now, this is a broad category because I want you to just think about what ways that the ways that you as an educator can be more inclusive of technology within your learning experiences that you are creating for your students. Remembering that we can no longer rely traditionally exclusively on lecturing, right? No longer can we allow that to be the only way that we teach and facilitate learning with our students. Simulation is a wonderful opportunity for us to engage in a more hands-on psychomotor as well as cognitive and effective learning experience with our students. All right, so for the didactic experience, we can engage perhaps in using different technologies in the classroom, such as showing video clips, audio visual. Only 5% of the content that we teach in a lecture is retained by students. Okay, this is evidence-based. And when we add audio visual, we can double the percentage of retention and sometimes even triple the amount of information students are able to walk away with based on the interaction they've had with us. Poll everywhere is another experience. Breakout rooms using Zoom is another experience. So our students they are required to engage in a lot of utilization of technology in the clinical setting. So the more we familiarize themselves and really put them in a position to be more open to use technology, even though it's not the same technology, it is just the philosophy and the mindset of creating a more open thought process when it comes to technology. And the other point I want to add is support. We all need support, right? Whenever we are trying to use new technology. So we have to do the homework. We have to think about plan B. The homework is being trained in using that technology. There are lots of YouTube episodes that are out there on just about every type of technology you can imagine. All right, so once you subscribe to this channel, you can also just peruse around on YouTube and see what other resources are out there to help you with some various forms of technology. And then third is informal learning. Our students as adult learners, we are encouraging them to do self-assessments as they identify their own gaps. And then they're going to use networking, coaching, such as tutoring and mentoring. Perhaps a junior student is going to be mentored by a senior student to help them talk through what strategies they use to get through their junior year. That is going to establish a sense of, again, community and inclusiveness, because students can connect with other students in a way that's different than how we as faculty connect with them. So we want to support that. We know with our Student Nurses Association, that's a great professional development opportunity for our young nursing students and our more experienced nursing students as well. But it also creates a learning environment and a sense of community and inclusiveness for our students to help them be successful. The last point related to informal learning is that the evidence tells us that learners who participate in their own learning, right, they're doing that self-assessment, they're taking advantage of more self-directed activities, they often attach stronger purpose and meaning to that content based on their lived personal experiences and their connection to that content, all right? And then lastly, we want to wrap up with a quiz question. Informal ways of learning are also effective and may include which of the following? You can pause right here and come back when you're ready to see the response. The answer is interactions with others, such as networking, coaching, and mentoring, right? We just talked about that. This is a form of collaborative or cooperative learning that's going to engage learners in that information exchange, allowing them to learn from each other, to leverage the lived experience of the senior nursing student, and for them to share that expertise and support the junior nursing student. Self-directed learning is really important. The more we are able to role model that and really support the nursing student in developing some of those self-directed learning opportunities as described in Knoll's adult learning theory and the work that was done there, the more they are able to really speak up and advocate for themselves, advocate for their future patients, and ultimately provide safer patient care. We want them to know what they don't know to close those learning gaps and to move forward. All right, our last practice question. So which strategy will the nurse educator use to best engage a group of learners? If you want to pause and come back, we'll look at the answer together. If you chose A, unfolding case studies, you are correct. That's going to promote cognitive learning. This is going to allow the students to learn from each other, again, establishing that sense of community, and also allows us as faculty to engage in closing those knowledge gaps, to bridge that theory practice gap that Patricia Benner talks about in her work. We can introduce clinical practices in the classroom, right? We may not have advantage of using psychomotor learning domains through those experiences, but we can still talk through the scenarios associated with the process of providing safe patient care. All right, one good example is if we have a heart failure patient, we could say to the student, you walk into a patient's room that has heart failure, they're having trouble breathing. What would your first steps be, right? And then we can sequence the details of what happens in that scenario as we talk with the students about care of the heart failure patient, helping them understand the why. That's a big part of the cognitive component. But then we also are able to factor in some of those psychomotor and affective learning domain elements as well. All right, that is our time together. I appreciate your attentiveness. As always, you can reach out to us with your questions at info@drssellerseducate.com and head over to our website if you want to learn more about all of our programs, including our Black Friday special, which is starting on Monday, November 21st. And you will also see some information about our monthly boot camp. All right, so we're excited to support you on your journey, and we'll see you next time. Have a great one, everybody. Bye-bye.